This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Wednesday, May 20th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on. And we appreciate you staying with us on Africa 54. The United Nations Secretary General Antonio Guterres is calling for global solidarity with Africa as an essential part of ending the coronavirus pandemic, saying the international action is needed to help strengthen its healthcare systems, food supply, and to avoid a financial crisis. Guterres said Wednesday he commends African countries and the African Union for acting quickly to enforce quarantines and border closures and relying on regional cooperation to try to stop the spread of the virus. The UN chief says the COVID-19 pandemic threatens Africa's progress while aggravating long-standing inequalities, heightening hunger, malnutrition, and vulnerability to disease. Already demand for Africa's commodities, tourism, and remittances are declining. The opening of the trade zone has been pushed back and millions could be pushed into extreme poverty. In addition to urging international efforts to support education and protect jobs, Guterres is calling on African countries to have, quote, equal and affordable access to any eventual vaccine and treatment. The Africa Centers for Disease Control and Prevention reports that COVID-19 has killed more than 2,800 people. Most of the confirmed cases are in South Africa, Egypt, Algeria, Morocco, and Nigeria. Worldwide, there are more than 4.9 million confirmed cases and 323,000 deaths from the coronavirus. Now to Burundi, where polls are open Wednesday amid health concerns over the COVID-19 pandemic. This is the nation's first competitive presidential election since civil war broke out in 1993, according to Reuters. The Election Commission is asking for a peaceful vote despite sporadic political violence. President Pierre Nkurunziza is stepping down after 15 years. His government has often been accused of human rights abuses. The national head of the World Health Organization was kicked out of the country last week following criticism that political parties were holding rallies further risking spread of coronavirus. 42 COVID-19 cases and 1 death has been reported in that country. Kenya has forcibly evicted over 7,000 people from Nairobi slums this month, despite a court order and in the middle of the coronavirus pandemic, resulting in a small riot. Authorities say they demolished the homes because they were built on public land, but some of those who were evicted claim to have bought the land. Critics note mass evictions during a pandemic are inhumane and could further spread the virus. Mohammed Yusuf reports from Nairobi.
42-year-old kiosk owner Daniel Ndungu and his 3 children picked through what is left of their home of more than 10 years in Nairobi's Ruai neighborhood. Defying a court order, authorities on Friday forcibly evicted Ndungu's family and more than 7,000 slum dwellers, making them homeless in the middle of the coronavirus pandemic.
I will stay here in the cold and wait. Now there's nowhere to go. Even if I want to move to a new place, there is no place to move and I have no money. Moving to a new place, people won't accept you because they will say you have coronavirus.
Others who could moved into the crowded dwellings of friends and relatives. The evictions, which started in April, left more than 5,000 people homeless earlier this month in Nairobi's Kariobangi neighborhood. The state-run Nairobi City Water and Sewerage Company claims ownership of the land and says the families have been occupying it illegally since 2008.
And people know this. People are told this in advance. You are actually sitting on public land. There's a project that is terminating here. We may be able to, probably open up and then pump sewage in this direction. People know this, but then either people don't move or they just continue staying there.
37-year-old Bucha Hussein Wako says he has government receipts showing he owns the land he was forced off. But public land is too often sold illegally in Kenya, leaving those who were cheated out of their money, like Wako, also homeless.
They demolished our home and poor people's homes. I slept in the cold for 2 days, and there is a coronavirus pandemic. They told us to go back home when we demonstrated against the demolition. They disrupted it and tear-gassed us.
A small riot erupted earlier this month as evictors clashed with the police in Kariobangi and set fire to cars and tires. A Kenyan High Court had earlier ordered a halt to further demolitions until a petition by residents is heard in June. But for the thousands of Kenyans already left homeless and those still being evicted regardless, there is little hope they will see justice. Mohammed Yusuf for VOA News, Nairobi.
As the global coronavirus pandemic continues to affect people's lives, some observers say Africa is likely to become the next epicenter. So far, the continent has recorded the lowest numbers of COVID-19 cases compared to other regions in the world, but the number of infections continues to increase. The Africa Centers for Disease Control and Prevention, a public health agency of the African Union, aims to build the capacity of member states to address any public health emergencies on the continent. Africa 54's health correspondent Lino Mudu spoke with Dr. Ahmed Ogwell Oma, Deputy Director of the Africa CDC.
Dr. Ahmed Ogwell, thank you so much for joining us today.
Thank you for having me.
There have been suggestions that Africa will be the next epicenter of the pandemic. So far, the numbers have been lower than other regions. What is being done?
We do not think that Africa is going to be an epicenter at the scale of what we've seen in Europe, in North America, and China. And the reason for that is because the lessons we learned from previous outbreaks have taught us that there are a few things that we need to do, including one, starting early. Africa started early. As soon as we saw the spread of COVID-19 to countries beyond China, we started preparing and building the capacity of our countries. Secondly is working in solidarity, neighbors supporting neighbors. In the beginning, we only had 2 countries that had the laboratory capacity to diagnose COVID-19. Today we have 52. It means that the resources, laboratory resources, the expertise on the continent has been shared and has built the capacity of other countries and other experts.
That's very encouraging. We know that testing is very much part of this strategy to prevent and also mitigate the pandemic. Can you talk to where Africa is in terms of testing capacities, whether it's rapid testing or just in general?
First is, as Africa CDC, we recommend PCR testing, not rapid testing. This is because we want to be sure that an individual actually does have the virus. That way, they are managed in an appropriate way. Secondly is the capacity for testing has been expanding. To date, we have distributed over 250,000 tests, and the testing is going on in a targeted way, where those who meet the certain criteria are the ones who are tested. And these numbers have been growing because more people are being exposed. And the numbers growth has not been exponential as has been seen elsewhere because of the measures that governments in Africa have taken. We are hopeful that the measures are going to result in the numbers not going too far up. And with the new partnership that we have started last month, it is called the Partnership to Accelerate COVID-19 Testing, PACT. This partnership is an initiative to increase the testing in Africa, where we intend to test 1 million Africans over the next 4 weeks and 10 million over the next 24 weeks. This is in an attempt to get a clearer picture what burden of disease we have for COVID-19 in Africa and therefore prepare for it appropriately.
Now, speaking of testing, I would like your reaction on what is happening in Tanzania. President John Magufuli said that the tests are flawed. That's one of the reasons why the cases are spike in his country, that they tested fruits and goods, for example, and the test came positive. What is your reaction to this?
The Africa CDC is procuring test kits from manufacturers that have been vetted. And we are very confident that the test kits that we are distributing to Africa are of good quality. They work. And we also follow up with the quality assurance. When tests are having problems, we know and we rectify. But in Africa today, all the tests that we have distributed to all the 55 member states are tests that are not fake. They are tests that are of good quality, and they are tests that are giving us results that are real. So long as a country has testing kits, so long as a country has the capacity to identify those who have been exposed, the tests that are being done are of good quality.
Tomorrow, we'll have part 2 of Lino Mudu's discussion with Dr. Ahmed Ogwell Ouma, Deputy Director of the Africa CDC, as they discuss further how the centers are supporting African countries in the fight against COVID-19. Since the coronavirus reached Senegal, a growing number of residents in the capital have begun ordering groceries online, a welcome boost to a fledgling delivery service in a country where produce is usually bought in shops or markets. Francis Maguire reports.
Since lockdown came to Senegal, many locals have started ordering their groceries online. It's a welcome boost for the country's delivery companies. Club Kossam is one of those firms. They've seen monthly sales surge in recent months. Operational manager Lucien Jeju.
Since the start of the pandemic, we've doubled our deliveries. We now do 1,300 deliveries per week. We weren't doing that much at the start, so we are growing, but the pandemic sped everything up.
Club Kossam's sales hit $103,000 in April, double the monthly average of around $50,000 the company saw before the outbreak. They have since hired 25 employees to cope with demand. The firm has also had to find new produce for customers, which they say has helped other local firms cope with lockdown restrictions. These farmers working in a village near Dakar now pick strawberries exclusively for Club Kossam. They also produce mangoes and grapefruits when they're in season. Club Kossam head of supply, Mohamed Sorgo.
Because of the crisis, a lot of markets were closed and the only choice for producers was to sell directly to organisations like Club Kossam. We helped small producers sell their produce because we managed to get all the necessary permits to continue to work, so it has helped them a lot.
Club Kossam was set up in 2016. 4 years on, and with new customers signing up, the company's managers are confident about its future.
That was Francis Maguire of Reuters reporting. The director for the Western Hemisphere of the International Monetary Fund, Alejandro Werner, says the region can expect some rough economic times after the end of the COVID-19 pandemic. He spoke with VOA's Jorge Agubian in this report narrated by Ben Sento.
New International Monetary Fund projects say the economy will contract even more than anticipated in the Western Hemisphere.
That could be more than 3%. That is what we are anticipating as a baseline scenario. And in Latin America, we could see a contraction that is closer to 8%.
In April, the IMF forecast a 5.2% contraction in the region, based on a scenario in which the health crisis eased in the second half of the year.
I think it will probably materialize, but it will materialize at a slower rate than we anticipated.
Many countries in the region are following quarantine guidelines and restricting activities, but the IMF official says he's worried about countries like Nicaragua, which aren't taking any measures to contain the spread of COVID-19.
At the end of the day, the contagion will come, and we will have a worse situation on the side of public health, and the same paralysis or even worse on the economic side.
As of mid-May, the IMF has granted more than $3.4 billion in emergency loans to 19 governments in the region.
The conditions on this matter have not changed.
Hasta la fecha no han cambiado las condiciones con respecto a ese tema.
Venezuela, which is going through the worst economic crisis on the continent, is the only state which was denied a loan. The international community still does not recognize the Maduro government. For Jorge Agobian in Washington, Ben Cento, VOA News.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, Africa leads the world in digital finance technology. We'll be right back after this break.
Hi, you just hi. Nina ukani luka buseni, nachimweo kapena ni malaria. Shazambia, mabombeli bakaunda muchalo chesu. Mabombeli bamakasa muchalo chesu.
Welcome back to Africa 54. U.S. President Donald Trump is doubling down on his decision to take a controversial drug despite scant evidence that the anti-malaria medicine is effective at stopping infection or cures patients with the coronavirus. On another front, the president is pushing forward with his threat to permanently withdraw funding from the World Health Organization. VOA White House correspondent Patsy Widakuswara has our report.
President Donald Trump, who reportedly has tested negative for the coronavirus, defended his decision to take hydroxychloroquine. He said he has been taking it for the past 2 weeks and dismissed an unnamed survey about the drug.
If you look at the one survey, the only bad survey, they were giving it to people that were in very bad shape. They were very old, almost dead. It was a Trump enemy statement.
There's little known about the drug's effectiveness in battling the coronavirus, but it could have serious side effects, including heart problems.
I would not recommend people just taking it to try to prevent them getting the virus at the present time, because the risks do outweigh the benefits if you're just trying to take it for prevention, unless you're in a randomized clinical trial where you can find the answer.
In the middle of the drug dust-up, President Trump is also pushing ahead with his threat to permanently cut off funding for the World Health Organization, accusing the WHO of allowing China to cover up its part in the coronavirus outbreak.
But basically, they have to clean up their act. They have to do a better job. They have to be much more fair to other countries, including the United States.
As U.S. criticism mounted, WHO member states agreed to an independent probe into the UN's agency's coronavirus response.
WHO remains fully committed to transparency, accountability, and continuous improvement.
Trump declined to speak at the assembly where Xi Jinping addressed WHO members. The Chinese president said he supported an investigation, but said it should wait until the pandemic is contained. He also announced China will provide $2 billion to help with the COVID-19 response in developing countries.
China is now working with the rest of the WHO as a member, and it can use that inside the tent status and its professed willingness, I think you can question its sincerity, to be part of the investigation. I think we can expect to see China use that insider status to slow walk and limit the investigation going forward, whereas the United States increasingly is placing itself outside of that process.
The U.S. supported the WHO resolution, but objected the call for universal, timely, and equitable access to vaccines, saying the language used would send the wrong message to innovators concerned about intellectual property. Patsy Widakuswara, VOA News, Washington.
As the U.S. and other countries slowly begin to lift strict COVID-19 quarantine measures, some elements of pandemic life won't be disappearing so soon. Masks and social distancing are here to stay, say experts. And while gyms and restaurants are reopening, their capacity will be cut in half. These and other measures appear to be part of the world's new normal, at least until a vaccine against COVID-19 is developed. Licia Bakalet reports this story, narrated by Anna Rice.
More than half of U.S. states are lifting quarantine measures and slowly reopening their economies. Many beaches in Florida and California are opening, as are restaurants, retail stores, beauty salons, and gyms throughout the country. But there are conditions under which businesses can operate: strict social distancing and face masks.
If I walked into a restaurant and saw that the hostess or the waiter wasn't wearing a mask, wasn't wearing gloves, I probably wouldn't eat there. It would make me pretty nervous.
Face masks are a must at beauty salons, stores, and public transport. This practice in response to the coronavirus pandemic is not going away anytime soon. In previous pandemics, some measures that felt strange at first remained with people and became habits.
Spitting was just a natural part of the American urban landscape, and it got extinguished as a behavior following the 1918 pandemic. When there'd be a water fountain, there'd be a common cup, right? This was just a thing that people took for granted, right? And that disappeared immediately after that. We had these lasting effects.
Social distancing is another thing that is unlikely to disappear soon, be it at the gym, the beach, or a walk in the park. Handshaking will be a strict no-no, as will be hugs and cheek kissing. And doctors say if someone is ignoring these rules, it's important to explain why you are keeping your distance.
My recommendation is to offer an explanation as you're doing it and sort of say, I want to embrace you too, but you know as well as I do, we need to obey certain rules right now. The way I express my affection for you is by not hugging you.
Despite the lifting of some quarantine measures, doctors are still encouraging people to stay at home more and avoid unnecessary travel.
But it's not going to be forever. I think in a year or two, we'll have a vaccine and be able to go back to our normal lives. And I think that's important for people to remember. There's a light at the end of the tunnel.
Most Americans have been staying at home for about 2 months, and most are so eager to get outside more, face masks and social distancing are not going to deter them. Felicia Bacalets in Washington, NRI's VOA News.
In our tech report, a study by MasterCard earlier this year says Africa is leading in the fintech market. It's rapidly adopting digital finance, mobile payments, digital credit, and cryptocurrency faster than the Western world. In Kenya, Popote Pay, a platform that enables businesses to go 100% digital, is making it easy for companies and businesses to monitor payments, sign checks, and other management and accounting requirements. Africa 54's Paul Ndiho spoke to Sam Wanjohi, founder and CEO, Popote Payments.
Mr. Sam Wanjohi, welcome to Africa 54. How are you today?
I'm very well, thanks, Paul.
You run a tech company. How are things under COVID, and what is it that you've been able to do to stay alive during this period?
Yeah, well, being in technology, I suppose we are a little bit more fortunate than bricks and mortar and more traditional industries. What we do is provide a solution that allows businesses and individuals to perform their financial duties, payments, accounting, etc., remotely. So for us as a business, the main challenge has been transitioning all our customer onboarding and support to online systems, and obviously working from home.
What kind of services have you come up with during this time?
Our solution is called Popote Pay, and Popote means anywhere, pay from anywhere. So years before this occurrence, we have always been promoting the attitude that business owners, individuals, managers, accountants need to be able to operate from anywhere at any time, and that can be made possible by technology. So our solution allows teams to take care of all their petty cash, account payables, and the accounting thereof remotely while they are not in the same place. So that is how the system has been working. So what we are finding is that ours is to explain to people how we can better support them at this period of time by giving our system Popote Pay, which allows people to requisition and approve payments using their devices anywhere. Payments are delivered instantly to all mobile numbers, to till numbers, pay bills, bank accounts without limits, and everything is accounted for in the system by general ledger, by projects, and it brings that remote collaboration to maintain complete integrity over their payments and to make sure that they are accounting and they are conserving enough cash as possible and that they are paying for the right things, that they have visibility on all expenditure before they make payments, and better transition them to, one, obviously traverse this difficult time, but also enable them to be more better to operate in a post-COVID economy, which is definitely going to be very heavy on digitization.
Just brought up some very interesting points. When you're dealing with money, the first thing that comes into mind is security. How secure is your platform, and what should people know about your platform?
Well, our platform is essentially an evolution of what you might already know from mobile money and bank systems. So, we're just several years ahead of what's out there by the big corporates. And our solution is extremely secure because we actually don't handle our clients' finances. So we are approved by the Central Bank of Kenya to work in partnership with payment service providers, which is the financial institutions. So we are directly connected into the M-Pesa environment and into banking infrastructure. Soon also to connect into Visa infrastructure. So when you're paying, your money is moving through these infrastructures, and we are giving you really the tools to control it and to pass the initiations, the approvals, to have visibility of the funds, to see where they have ended up, the final recipient, and then to account for those transactions.
So basically, you're leveraging on already existing technology.
Yes.
Sam, how big is the fintech industry in Kenya?
With the advent of M-Pesa and the success of it and mobile money in general, that has created a platform for a lot of innovation, because everyone expects now to receive money instantly. You delay a payment and people ask you, but why didn't you just send it to me by mobile money? So we're definitely ahead of most of the world, definitely the leaders in Africa.
Who uses this, and how effective has it been for them in terms of feedback? When you hear back from them, what are some of their concerns?
So the biggest challenge is that barrier that a lot of people have to adopting technology. We get a lot of constructive feedback that we then include to developing the system further, but today is the time just to look forward because technology is an equalizer across the world.
Thank you so much, sir.
Thank you, Paul.
That was Africa 54's Paul Ndiho speaking to Sam Wanjohi, founder and CEO Popote Payments in Nairobi, Kenya. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.